Telehealth has rightly or wrongly earned itself a bad name in the healthcare industry over recent years, leading many clinicians and patients to lose confidence in the use of digital health services. But Inhealthcare believes that when technology systems are used correctly, digital platforms can ensure information is shared efficiently between different NHS organisations, improving patient outcomes as well as saving money. Ed Barron has this report.
Inhealthcare is a leader in the provision of digital health, using communications technology to exchange data between a patient at home and medical specialists, thereby making the process of diagnosis and monitoring much easier, more efficient and less costly.
I think we have a problem in the health service of a mismatch of demand caused by an ageing population, increasing incidence of long-term conditions, and the fact that people need more support in a dissociated society with the actual resources that are available in the NHS in terms of personnel. And digital technology, the sort of things that people have that everyone has in their pockets, I think is the key to actually sorting this out.
It's estimated that by 2025 there will be 18 million people in the UK with a long-term medical condition. It's going to place a huge strain on NHS resources, and Inhealthcare has been established to provide the most cost-effective digital health service possible.
Patients' better clinical outcomes will mean that they don't have to visit formal healthcare organisations as frequently, either as an outpatient or as an inpatient.
This has been done for years with people like diabetes, where they test at home and they apply their insulin. And what this is about is applying the same philosophy and the same technologies to a whole range of services. A lot of people have to go to hospitals to see an outpatient department or see their clinician, and what these technologies allow them to do is to be tested and cared for at home, and it allows the clinicians to focus more on people who are really quite ill.
An example of this already working well in action is this service, enabled by Inhealthcare and run from a district general hospital in North East England. It allows elderly patients at risk of undernutrition to input their weight on the telephone after receiving an automated weekly call.
Please enter your weight in kilograms.
Using the keypad, they also state how much they're taking of their nutritional supplement. Clinicians can then take the necessary action straight away.
From that telephone call, we can work out the patient's risk of undernutrition, percentage weight change, compliance in drinking their supplements and appetite, and can be very proactive then at putting in place appropriate treatment plans with immediate effect. Patients are loving it. It saves them being dragged into a clinic. It means it's happening in their own home. They find it very simple to use the technology.
According to reports, accident and emergency departments across the country are in crisis. The technology being developed by Inhealthcare and other companies aims to reduce the number of patients attending A&E when they don't need to. Sharing information can also reduce the number of ambulances that are being sent out unnecessarily.
The North East Ambulance Service has no doubt about the increasing impact digital health is going to have.
Having access to greater information on the patient, I think, will have a great input into trying to prevent unnecessary admissions into hospital. Obviously, we can get a better picture of the patient at the point of call. We can try and decide on what's the best resource to send to that patient. So it mightn't necessarily be a double-crewed ambulance. We might be able to send a practitioner instead, which is what the patient needs, as opposed to being taken to hospital.
Inhealthcare's patient information portal can help to bring all the relevant patient information into one place and ensure the best treatment is administered or advised first time. The technology is bespoke and configurable by clinicians, and just as importantly, Inhealthcare's commercial approach is refreshingly different too.
We start charging the NHS organisations when they start seeing the benefits of the service, not up front. So until they start saving money, they don't start spending money, and I think that's a fresh approach, and it's one thing that the NHS has been crying out for.
Helping provide a more cost-effective health service while keeping patient outcomes as the key consideration. Inhealthcare is a fresh approach to digital health.